Well, Memorial Hospital has earned a distinguished 3-star rating from the Society of Thoracic Surgeons, and it is for the hospital's patient care and outcomes in coronary artery bypass grafting. This is the highest national 3-star rating in cardiovascular surgery, making Memorial among the elite 5% in North America. Joining me now is Dr. Dan Mueller, a cardiothoracic surgeon. Doctor, thank you so much for coming on this morning.
Carly, thank you very much. They don't let me out of the operating room very often, so I appreciate whenever I can do that.
Wonderful. It's so glad to have you here. And starting off, what is CABG surgery?
So CABG is an acronym for coronary bypass grafting. In other words, it's when you do a bypass for a patient who has cholesterol buildup in their heart arteries. It's the most common procedure done for cardiac surgery.
And what are symptoms which occur in someone who needs this type of surgery or CABG?
The usual symptoms are chest pain. Most people get that. But then you can also have shortness of breath or pain in your neck, pain running down your arm, as well as being very sweaty. But the traditional symptom is an elephant sitting on your chest.
That is definitely a big sign. And how is it determined that a patient needs a CABG?
After an extensive workup, they go through a coronary angiogram or a cardiac cath, and it looks at the heart arteries, the anatomy of the heart arteries and the blockages. And usually when you have 3 of those arteries blocked, or when you have the artery on the left blocked, or what's called the widowmaker block, that leads to usually indicates you need bypass surgery.
Okay, and only 5% of hospitals in the USA and Canada have a Society of Thoracic Surgery 3-star rating. I mean, this is a big deal for Memorial, and why is this so important?
Well, it just validates what we've done over the last 4 years. We've looked at everything. It's kind of like bringing an A+ home when you're a kid.
That's truly incredible. And how many surgeons and patients participate in this rating?
So there's about 7 million patients in the database, nearly 4,000 surgeons. 90% of the hospitals participate in this star rating.
And how is this rating/grade determined?
So they first do a risk-adjusted formula. In other words, they level the playing field because not all patients are the same. For example, if you have a 60-year-old who has high blood pressure, it's not the same as an 82-year-old who has emphysema, diabetes, and high blood pressure. So they kind of level the playing field, and then they look at 4 components. The first component is how your survival is after bypass surgery. The second component is what your complication rate. And obviously, if you have low complication rate, you do better. And then the third is if you use the internal mammary artery. The internal mammary artery is the best tube or graft that we have. 90% of them are still working 10 to 15 years later. And then the fourth thing is if you send them home on the correct long-term medications. There's something called a beta blocker, something to lower your cholesterol, and an aspirin. It's been found long-term that patients survive and live much longer if you send them home on those medications.
Wonderful. And how does the future of cardiac surgery at Memorial Hospital, what does that look like?
Well, so obviously we want to continue this 3-star rating, and we just started an ECMO program because the COVID outbreak, which is really an artificial lung, artificial heart for when patients get severe COVID and their lungs or heart temporarily don't work. And then we're looking possibly at what's called a left ventricular assist device or a artificial heart to be used in the future. Those are the kind of things that we're looking at in the future at Memorial.
That's truly incredible. And thank you so much, Dr. Mueller, for joining us this morning. Definitely want to congratulate you and everyone at Memorial on this rating.
Absolutely. Thank you, Carly. Appreciate you having me on.